My name is Jacob Smith-Yang. I'm Executive Director of Massachusetts Asian and Pacific Islanders for Health, based in Boston, Massachusetts.
Thank you. And what are the challenges HIV prevention and care has in the Massachusetts area?
One issue for us is that we have a lot of our Asian populations are newcomer refugees and immigrants from Asian countries. And so many times we're doing some very basic education about what HIV is and really dealing with some myths and misconceptions about how it's transmitted. So a lot of our work is very basic awareness building, and only with that can we build on to other behavioral interventions. So it's like we have to do this pre-work before we actually get to the behavioral interventions that prevent HIV.
So Jacob, where would someone go to get an HIV test at your organization?
Well, MAP offers two ways to get tested. A lot of our testing actually happens mobily. So we have community health workers who are also trained HIV counselors and testers, and they go to the community, and they usually find a community space. Sometimes it's a room at a health center or another community-based organization, and they administer the counseling and testing. And we use an oral mucosal test, an OMT test, and that basically is taking a swab of cells from the inside of the mouth, and we send the sample to a lab, and about 2 weeks later we receive your result and we give it to you. You can also come to MAP for drop-in hours. Currently they're Wednesdays, 11:30 to 1:30, but we're also very flexible about making sure people can get an HIV test when they want. And so my staff, and there are 3 people trained to do counseling and testing, really take appointments by request. So we encourage people to call ahead and stop by and get their HIV testing that way. All the HIV testing we do is anonymous testing at MAP for Health, so people don't have to give us their name or write their name down anywhere, and I think that's another important thing about what we do at MAP.
Thank you. So how much time does it actually take for someone to come and get an HIV test?
The counseling session, including sort of taking the sample, 20 to 40 minutes, and then you would have to come back for a follow-up result, and that would be a more in-depth discussion about your results, what they meant, and any next steps based on your results moving forward.
Wow, that's no time at all. I think I might have to go immediately to get one. Thank you. Why is it important for CDC and other funders to focus on HIV in Massachusetts?
Well, in Massachusetts, we've been very lucky in that we have a very good HIV surveillance system, and our surveillance department has run some breakdowns of the surveillance issues and what it looks like for Asians and Pacific Islanders. One thing that's come out in a Massachusetts Department of Public Health report is that Asian and Pacific Islanders, more than any other group, are presenting later for care. And this is a very serious issue. It suggests to us that people don't understand the risk for transmission, that they are at risk, and therefore they don't get tested, they don't know they have HIV, and they don't take advantage of the life-saving, health-extending drugs that they could be on. So I think that's one reason we need to care about it in Massachusetts. I think the second thing is that HIV awareness is really working. The work that we're doing in the community, we see really paying off. More people are presenting for HIV testing than ever. There seems to be a sense that it's something you need to do, and it's a good thing to do, and we really want to capitalize on those successes.
Thank you. Can you talk, just as a follow-up question, can you please talk about what types of specific services that you're providing to really get that message out there so that people do understand the risks and information about HIV and AIDS?
Sure. Our prevention program does a couple things. We do a lot of outreach in the community. We go to places in the community where members of our community live, work, play, hang out. So there's a lot of neighborhood outreach. This is done by our staff, but also by people from the community who are stipended volunteers. So you'll have someone coming up to you in your neighborhood who you probably know, or maybe know indirectly, but someone familiar to you, and speaking to you in your language about the importance of HIV and getting tested, and talking to you about what the risks are and whether or not you might be at risk. So I think that's been a real key to making the program successful. Trust is really important in our community, and the willingness of our community members to accept services is really predicated on knowing who's referring them to the services. And so that's another strength that's really worked out well for the programs that we're doing. We do individual level and group level risk reductions. We do workshops. We do community events. So we do outreach at Kamai New Year, for example. We had over 500 people in Lynn, Massachusetts come to our Kamai New Year celebration where we talked about HIV and the importance of getting tested. And so we're really trying to be everywhere Asians are to get the word out.
Thank you. And so what is really working to reduce HIV in Boston right now?
Well, I think we always have to ask what's working and how can we do it better. Right now in Boston, one of the things we're working on is for our testing program, really looking at social networking as a way to reach people. So rather than just saying, hey, MAP offers HIV testing, come on down if you think you're at risk, working with people who we know to be at risk or who are HIV positive themselves, and having them think about people they know who might be at risk, who can come into our programs. And I think this is a really high leverage strategy to reach the highest risk people, because obviously that's who we want to test. There are a third of the people out there don't know that they're HIV positive, and we need to do a better job of finding them. And I think that's one of the tools that's really helping us.
Thank you.